Welcome to today's session, organized by VODAN Africa, as always. This is the 18th installment of the Metadata for Machines workshop. My name is Charles Kahiro, and I am the Creative Director at TravelWorks Africa. So for today's session, we will be hearing from the Tunisian team, led by Professor Miriam and Ms. Morgan. They will give us their presentation today on their journey to the installation of the VODAN in a box. During the presentation, as always, let's try and keep our mics muted so we do not disrupt the flow of the presentation. So if you are yet to mute your mic, please do so now. And if you have a question, as always, you can always type it in the chat box and I will bring it up during the presentation, or we will also have a Q&A session at the end of the presentation. So we can also wait for that one as well. With that, I will hand over to Professor Miriam. Welcome, Professor.
Thank you, Charles. Hi, everyone. First of all, I'd like to thank all the VODAN African team to give us this opportunity to share our experience in the installation of the VODAN inbox. A special thanks to Professor Miriam, Professor Francisca, and Eric for their ongoing support. In today's presentation, we will start at first by giving an overview of the epidemiological profile of the COVID-19 epidemic in Tunisia and how we try to fight this epidemic. Then we will ask my colleague Morgan to present some particularities of the VODAN project in Tunisia. She will focus on special vulnerable groups that can be touched by this epidemic, which are migrants and refugees. And at final, I will return to present the installation of the VODAN inbox and to highlight the main difficulties that we have for the moment. And it will be the occasion or the opportunity to ask for help or for solution. So let's start by looking to the Tunisia profile of this epidemic and the action done to fight this situation. Overall, the Tunisian strategy to respond to the COVID-19 epidemic took place on 3 phases until now. In fact, the first one was launched even before the occurrence of the first case and aimed to achieve the general objective of the implemented strategy, which was to curb the spread of the virus within the population in order to avoid overshooting the response capacity of the health system. Then in the second phase, which consisted on the targeted confinement, we had new challenges to rise, and the special one was to avoid the rebound that would again threaten the health system. Now we are in the third phase, which is the border opening phase. Just I have to highlight that each phase have specific principles and measures that were established. So for the first and the second phases, there are 5 principles, which we call it the 5 early. The first one was the early detection of cases. So we indicate the PCR test for all suspected or probable cases or as part of the contact tracing. The second principle was to the early declaration of cases confirmed by the test laboratory. The third one was the initial early investigation. And the fourth one was the early isolation of all cases. And at final, the treatment and the early management of the active cases. These principles were presented through public health measures, which were the isolation of all positive cases, the quarantine of persons at risk, especially healthcare providers, returnees, contact persons, and the the general confinement or the targeted confinement. In the next slide, you can see the chronological overview of all measures introduced during these previous two phases. So we have the screening of all travelers at point of entry, then the suspension or the closure of maritime borders, and after we have the general confinement. But the main date that we have to mention is the 4th of May, when we pass it to the target progressive confinement, given the stability of the epidemiological situation. Then, and since the 27th of June, we move it to the border opening phase. This phase was based on the approach of the 3T. 3T refers to, the first T is the considerable increase in the testing capacity among the travelers. The second one refers to the increase in the quarantine. And the third one refers to the increase in the contact tracing based on new digital tracing approaches. So this strategy of the 3T was conducted according to some principles, which are at first, we have to establish health protocols taking into account the profile of the traveler on arrival and in the country of the origin in order to prevent the introduction of the virus. The second one, the strength of the case detection system at all points of entry to the territory. The third principle was the use of the travel identification, monitoring, and tracking applications. The fourth one was to strengthen the capacity of testing and screening of cases. And the last one was to strengthen the potential of health teams in all health districts to ensure the follow-up of Tunisian residents on their return to their localities. According to these principles, several recommendations were launched. There are at first a general recommendation for travelers. For example, we have the Traveler's Notebook, which is a book that contains information about the transmission of the virus and the quarantine process. As a second example, we have the health form, which is an application called in Arabic, أحمي border. To refer to, we have to protect travelers. So we have to, according to this application, we will follow travelers during their sitting in our country. These measures or general recommendation were associated also to specific measures by country of origin. So countries were classified into 3 levels of risk, as you can see in this table. The low one, colored in green, and these levels were classified or were indicated according to the scientific criteria and epidemiological indicators of the different international organizations. And many updates of these classifications were done according to the pandemic evolution around the world. As you can see in this slide, there are specific measures for each country, for example, for France, for Italy, etc. These measures have led to the current epidemiologic situation, which can be qualified, unfortunately, as unstable. So by the 24th of August, we accounted a total of 2,893 confirmed cases with 71 deaths. So we have 1,368 active cases, and the main district concerned by these cases was Gabes, which is located in the south of Tunisia. Then, according to this graph, we can note that there are an increase of the number of daily cases, especially since the opening of the borders. Also, we have the increase in the cumulative cases. And in this graph, we can see the combination of all the indicators. So we have the confirmed cases, which are in increase. Also the active cases, especially since the opening of borders. And we have also the evolution of the recovered persons. At final, there are many challenges to tackle to face this epidemic. So a significant logistical and capacity constraint, which range from the availability of qualified persons to take precise samples and contact tracing and tracking activities, to the time required for laboratory analysis and the availability of some regions. On the other hand, the use of digital application could help to improve the speed and the efficiency of this strategy as adopted in some countries. There are many other challenges which are we have to plan, especially with the start of the academic year in the next few weeks. Overall, to overcome this pandemic, challenges are numerous, but they are even more important when it's the case of some vulnerable social categories, such as migrants. So these letters are the main target population of the VODAN project in Tunisia. I have to remind just that the objective of this project is to determine the impact of the COVID-19 crisis on health, social situation, and mobility status of migrants from sub-Saharan Africa hosted in Tunisia. This population has a lot of particularities that deserve to be mentioned. For this, my colleague Morgan will talk about this in the following presentation. So the floor is yours, Morgan.
Thank you very much, Maria. And thank you to VODAN to host this presentation and to support this project from its very beginning. So if we go to the next slide,
okay.
The first impact. So this is overall a global map that can show where are the asylum seekers in Tunisia. There is actually no data about the migrants because migrants are undocumented. They are most of them illegally on the territory. So there is a very few reliable data of how many people are where, but for the asylum seekers, we can see. And it gives also a picture of how it is also for the migrants. So we can see that in the south, in the area of Medellin, so close to the border to Libya, there are a lot of people living. They arrived by land, crossing the border from Libya, or by boat when their boat had a problem in the sea when they were on the road to Europe. There are also a lot of people in Sfax because it's one of the points as the south, one of the points of departure for people living and taking the boats to Italy. We also have migrants living in Tunis, in Sousse, and there are also people who arrived crossing the border with Algeria, okay? And we have also people who arrived by plane. Most of them are victims of human trafficking. And most of them are originally from Ivory Coast. So this is the situation geographically. If we go to the next slide, See that I want to explain you that for the migrants as for the Tunisian, the first impact of COVID-19 is economic. The country is really suffering from, first of all, from the lockdown, from at the beginning, the closure of borders. The tourists are not coming anymore. Most of the migrants are working in a precarious job, or day-to-day jobs in restaurants, or in buildings. So a lot of them lost their job during the lockdown. Most of them found a new one after, but it's still very hard for them. And they were helped mostly by Tunisian citizens and by Tunisian association. So as you see on this picture, it's an organization that was set up really quickly in the beginning of April. It's people who have no funds. They just decided to gather, ask on the radio for the people to give food or funds, and then distributed it to the migrants in Tunis. And this happened in most of the cities where migrants are living in Tunisia. If we go to the next slide, one of the other main problems that are facing the migrants since they have economic difficulties is problems to pay the rent. During the whole lockdown, they were not working. So some of them, as you see on the picture on the right, are hosted, like those are asylum seekers. They are hosted at UNHCR foyer. But others, if you watch on the picture on the left, are hosted by themselves. So here, for instance, they are originally from Ivory Coast and they are living in a garage where they can live in exchange for working the whole day in the garden and cleaning the house and so on. So it's a very precarious situation. The Tunisian authorities have called landlords to be comprehensive with the migrants and also with the Tunisians who are in a precarious situation, and to leave them inside the house, but some landlords cannot afford to live without the rent. So people have been expelled from the house. But also in a lot of cases, Tunisian association intervene to help or pay the rent for the people who really needed it. If we are going to the next slide, another really big problem for migrants in Tunisia and asylum seekers is difficult access to healthcare or assistance and NGOs that are supposed to help them, but most of the time they don't have good access to those associations, or they don't know that they have the right to go to those associations. Sometimes also the NGOs have just too many people putting them. And it's hard also for migrants and asylum seekers to go to hospitals because they are undocumented, so they fear to be arrested and to have problems with the police, end up maybe in jail or in detention centers. So they fear to go, even if according to the law, they have the same right as the Tunisian to be cured. Also, sometimes the doctors and the personnel at the hospital are not aware of that. On the next slide, so one of the main consequences of the lockdown and the corona crisis is an exodus to Libya or Europe. So in July, more than 4,000 Tunisians arrived in Italy for several reasons, because of the economical impact of COVID-19, because also Italy has claimed that they will legalize people who were working without paper in Italy. So after that, they came back on this statement. But yeah, really at the beginning of June, July, August were months where a lot of Tunisians left the country. 42% of the migrants who arrived in Italy in 2020 are Tunisian. The sub-Saharan migrants who are living here in Tunisia, some of them are also nowadays taking those boats with the Tunisians. So now it's a mixed migration. If you see on the picture here, so this is a fisherman who has already brought people to Europe. It is not, as in Libya, a really organized human trafficking. This happened, this exists in spikes, but it's in a small quantity. But in the majority of the cases in Tunisia, the smuggling is fishermen who are just making extra money, taking some people with them on the boat, or fishermen who are selling their boat to migrants because they know that they can sell it to a very expensive price, are also just people who gather themselves, buy a boat together, and then go themselves to Europe without using a smuggler. What is also very alarming is that hundreds of sub-Saharan people are crossing the border back to Libya, which means that they didn't receive sufficient support here in Tunisia, and they prefer to go back and take the risk of being kidnapped, put in detention, and face abuse and torture to try again to reach Europe. So on the next slide, so yeah, our research here in Tunisia. So we gathered this research. Sorry, I have to begin again my sentence. So to realize this research, we have collected articles and press releases in Tunisia and in Libya and in Niger in local languages. So for that, we had the help of students from the University of Sousse and also from journalists and researchers from Sahara FM, a radio in northern Niger. On the next slide. So we also made about 120 interviews on this topic in Agadez, in the north of Niger, done by a researcher over there. In Tunis, Sousse, Sfax, Zarzis, Kelibia, Djerba, Kerkena, Medellin, which are all cities where a lot of migrants are living, or points of departure. So this is in Tunisia. And we also made interviews in Libya through phones, WhatsApp, and Messenger with some contacts that we have over there. So this is actually a lot of data that we have collected. So now we have to code and label those data to transcribe these interviews and to make it fair. So this is going to be possible thanks to VODAN. At the University of Sousse, we have, of course, Dr. Mariam Zarra and Professor Hassan Boubakri, Professor Ali Mtarwi, who are supporting the project since the very beginning and who are working on that. We have also 6 students who are working on the transcription. We have also students working on transcription, coding and labeling in Kenya, in Uganda, Ivorian student in Tunisia, after journalist and researcher in Niger, fixer and interpreter in Tunisia who were really helpful for the research on the field. And of course, we always had big and very important support from Tilburg University and Professor Miriam Van Hessen. So I will let now Mariam explain how we are going to make those data fair.
So thank you, Morgan, for your brief presentation and interesting presentation about how you deal to collect information among migrants in Tunisia. So let's turn now to the installation of VODAN inbox. And I will try to make demonstrations at the same time with the presentation, hoping we will not have a problem of connection. So just to remind, as it was set and recommended during training sessions, there are in total 6 steps for the project VODAN that we have to achieve. So now we achieved about 2 or 3. So the technical installation of the VODAN, phase data point, the local configuration, and we try to enhance the link to data. So let's start by the technical installation, especially for the phase data point in Tunisia. I have just to mention at first that we have only one installation of installation site related to the University of Sousse, but the configuration of this site is still up to now monitored by the CCK. CCK is the internet service provider for all establishment, agencies, or administration under the Ministry of Higher Education and Scientific Research in Tunisia. In this presentation, I will not present details about the installation process because, as I mentioned, we didn't have until now the access codes for the server. At first, and for to have the access for this subdomain, we had to sign a commitment between the University of Sousse and the internet service provider, as you can see in this slide. Then, as you know, and that was recommended by Eric in previous training session, we conducted at first the local deployment of the FAIR data point. And then we moved to the production deployment of the FAIR data point in its first version. After we moved to the VODAN inbox version, and the different services of the VODAN was installed. As you can see in this slide, we installed the VODAN FAIR data point. We then installed the CRF wizard, and recently we installed the Allegro graph for the submission of the CRF data. Then we proceed as it was recommended by Eric. We have to follow the metadata structure, the FAIR data point, the catalogs, the dataset, and the distribution. We have to specify each of these elements, as it was also described previously during the scoping exercise. So let's turn for the demonstration. So we will just a minute. So this is I think that my screen is shared. So this is the FAIR data point as it was installed. And this is the description of the FAIR data point. We changed the password as it was indicated. And this FAIR data point will contain different, mainly 2 catalogs. As it was reported by Morgan, there are a collection of data from reports and articles, and also from interviewees with migrants. So there are 2 catalogs. As we can see, The first one is the media reports. This catalog will contain media reports published during the COVID crisis. We describe this data set, and we used also some themes according to Wikipedia or Wikidata taxonomy, as it was, as you can see here. And through this data set, we can access to the distribution. So we can edit, we can change themes, we can specify some keywords, and we hope to move for the next step when we have to link this data set with metadata. So this was the FAIR data point. Just this is the presentation. I made some screen sheets for the case we had connection problems. So let's move now for the data entry and how to link data to the FAIR data point. For this, our team tried at first to use the CEDAR metadata platform. Just to remind, for making metadata with CEDAR, there are 3 steps. So the first one was to create the metadata form if we didn't have an existing one. It is the case of the Tunisia team. Then we have to complete the metadata form, and at final we have to submit and to publish the metadata form. So for our case, we did the 2 first steps. So after the specification of after the collection of the articles, as you can see in this word sheet, we decide in the metadata to collect and what will be the main items that will be extracted from the articles, such as the country, the type of the event, the actors involved in this event. So this information was collected at first in this Excel sheet. Then we created an account in the CEDAR. I will present directly our account in CEDAR. So we create an account. It's all. This is our workspace. At first, as I mentioned before, we have to create the template. This is the template that was created for our project. So I will open it. And the different items that I presented in the Excel sheet were introduced in this template. As you can see, there are the country, the event year, the type of events, it is health or social or movement, the type of event, if it is a health event, the number of infected migrants, if it is mentioned in the article, the number of migrants in quarantine, the different actors that can be involved in some events, their origin, the language of the press article. So this is the template that was created to respond to our objective. Then when we return to the workspace. And after the creation of the template, we shared it with our different members of group. So we create a group in CIDAR, which called VODAN VODAN Tunisia. And as you can see, there are the different members of the team that are involved in this group. So the next step was to start the entry of data. So we tested this, and you can see here the metadata entered for some articles. Let's see an example. For example, this one. So there are the information about the article number 27. It is an event that occurred in Tunisia in 20 April. It was about a social event. It was about regulation and liberation. So the main actor involved was migrant from El Wardia. It was a written press, written in French, and it had a title, Tunisia call for the regularization of migrants and the release of detainees from El Wardia. And at final, we have to add a link to the press article. So it was an example of metadata according to the press, specific press article. So it was our experience with the CIDAR platform. But at final, we have some difficulties in the manner how to publish the metadata. Did we have, or do we have to manually copy the metadata, or there is, or we have to follow another way? So this is our mainly question about this the use of the CIDAR platform. Then when we installed the VODAN inbox, we tried to use some particularities of the CRF wizard. So the CRF wizard gives also the opportunity to create a template. So as we can see here, just a minute. This is the CRF wizard. Similarly to the fair data point, we started by changing the profile of the user or the administrator. Then we have the opportunity to edit or to create a template. We created a template for the migrant in Tunisia, as you can see here. And there are the different sections. The first one, for example, about events, the date of the event, the type of the event. And then there are some statistics about the number of infected migrants, number of deaths at sea, number of arrived people through borders. Then the next section about the actors and their origins. And at final, the source of the article and the language and the link about this article. We can press here to have a preview for this template. And then when we move for the CRF templates, we note that our new template is added to this list. And we can see it or see some details about it. We tried to test some information about the template. We create some example of templates like this one. So the information we have to add. It's the same thing for the CDAR template. But we stopped in this step because when we try to create a report that will give us the opportunity to publish then the metadata in the dataset, we have a problem with to the access of the specific template that we created before. So it is the main problem that we have to resolve. So this is it was an overview of the situation of the VODAN inbox installation in Tunisia, the specificity of the information that we have to collect. It is about information about migrants from media reports and from interviewees. So we think that we have a lot of other action to do to perform our situation or the situation of the VODAN project. Thank you for your attention, and at final, I will be pleased to respond to your question if it's the case. Thank you.
Thank you, Professor, for the great insights as to the two experiences, being able to use the CEDA as well as DSW. I think we'll start taking some questions. I can see Bart has his hand raised already, and then we can proceed. Apologies to all the participants. It seems we have some technical challenges with the chat box. So just raise your hand or unmute your mic. We'll start with Bart and then others following.
Yeah, that's good. Thank you, Charles. And good afternoon to everybody, of course. First of all, I'm very impressed by the presentation that we just had from Mariam and from Morgan. Excellent info. I think it gives a very good overview in terms of the challenges and also in terms of the things that we still need to do and we need to work on. I have two questions mainly for Mariam. And the first one is, when you talk about the metadata schema that you actually used, both in the CEDAR structure and in the wizard structure, did you define these metadata schema elements yourself, or did you use some kind of existing metadata schema for this? Is it clear what I'm trying to ask?
Professor Miriam, can you hear us?
Professor Miriam?
Thank you, Bert.
Yeah.
Yes.
So, it is a good question. Just I have maybe to invite Morgan to participate to respond to this question, because in fact we. Before the elaboration of this schema or this template, we discussed many times about the main elements that we have to add to this schema, and especially we look to the information contained in some articles, and an overview for all the articles, and we try to extract information that will be common about around all the articles.
Yeah.
Yeah, we inspired ourselves at the beginning from another excellent video that was made for research in Uganda on a totally other topic. But to know what was the main data we had to collect, we inspired ourselves from that. And after, as Mariam said, so we checked what was our articles talking about. And after we had this question, okay, but what do we want as information to come out in the data? So we want to be able, with the metadata, to know how many migrants have been infected by COVID-19, for instance. So we add this box, how many migrants are infected. We want to know how many migrants the country. We add this to be able all the time to answer to our questions.
Yeah, excellent. I think that is the right way of doing it. And then, of course, you know, what we want to achieve is that if other countries want to record similar things, that they use that same schema, so that you have almost an automated interoperability if they start using that same schema. So that will be an enormous advantage, you know. And possibly others may add one or two elements that they also think it is important. And then as a community, you've kind of defined, you know, what are the elements that you want to track for all those articles. So this is very good. Second question I had for the team at Sousse also was that I understood that there was or that there were some technical problems in terms of accessing the template once it had already been set up. Has that been let's say, escalated to the technical people, or is that something that you can resolve yourself? Or do you need maybe from our side some technical expertise to resolve that? Can you elaborate maybe a little bit on that?
Oh, I think that we need some technical expertise, especially for the use of the CDAR or for the CRF wizard, because when we look to some videos, we noted that the possibility to use some option are available, but when we try the same thing in our case, we found that some possibilities is not available. So we think that the technical maybe problems didn't wasn't related to local technical problem to our country, but for the general use of the platform, maybe. Is it clear?
Oh, okay. Can you then specify, articulate, or write down exactly, you know, what went wrong, or what in your case should be technically resolved, and then I can pass that on also to the technical people, so that they will take a look at it. Is that feasible? Is that doable?
Yes, I will share my screen another time to demonstrate when we have a problems. So, for example, here when we try to create the report, when we look to the video or the tutorial, there are the possibility to have to choose a special template, especially the CRF done by the WHO. But in our case, it's not available. Maybe we have to import the template here, but when we try to do this, for just a minute. is this one. We can do it. So that's the problem for the CRF wizard. For the CDAR, it's also the same thing, because when we try to, for example, for this metadata, for the first one, we have to copy or for the publication, we haven't access. Especially for the CRF, this is the main problem for the importation of the template that will give us the opportunity to create a report in the next.
Yeah. Okay, I will report it back to some of the technical people and see if they can help you here.
Okay, thank you, Bert.
Thank you. Excellent, excellent presentation.
Thank you.
All right, I see Professor Van Rijssen has raised a hand.
Hello, everybody. This is me. Congratulations also on really excellent presentation, Professor Mariam and Morgan. And I think my question was related to the question that Bert was asking, in the sense that once you had decided the data that you wanted to put in CDAR and later in the CRF form that you were creating, the machine readable semantic equivalents, did you find them in CDAR and CRF, or did you create them yourselves?
It was created by the CDAR, fact. So when we open, for example, sorry for the, I have to share my screen another time. So for example, for this example of article, at final we have the an RDF form that will be that have to be generated.
And so for all of the items, all of the data points that you had, you were able to find the schema that would then translate it to RDF. You didn't have problems with that, because that's quite impressive.
Sorry, can you?
Yeah, so on each of the items that you had, you were able to find the equivalent from the that then would translate into the RDF schema. So all of these points you were able within CDAR and in CRF to find the proper translation to an RDF readable, machine readable language on the options available.
Yes, absolutely, yes.
And was that difficult? Did that take a lot of time?
Maybe now with the number of articles that we have to enter, and with interviews that as it was mentioned by Morgan, we have about 300 articles and 120 interviewees, but with the help of students, we can do it. Yes.
But to make the template itself, I mean, was that difficult?
No, really no. It's like Google Form.
Okay, that's good to know. Great job, really.
Thank you, Maria.
Any additional questions for the duo from Tunisia? Feel free to unmute your mic and just ask the question directly.
Yes, I have another question if we have some more time. This is Bert again.
Yeah, we have 2 minutes left, so go ahead.
Yes, I wonder if you also looked at patient data and the possibility to either input patient data or to link patient data. Have you also looked at this in Tunisia?
It will be an interesting opportunity for us because until now we didn't have any publication about the situation of the COVID-19 in Tunisia. But when we use the VODAN project, it will be the opportunity to publish our data. But the real problem that I think it will be we can have we have to make the authorization for the use of this information about patient. And we have to maybe to sign some commitment with the Ministry of Health or maybe with some hospitals. For example, in Sousse, we have two mainly university hospitals that manage patients, and especially one of these hospitals is the reference hospital for the COVID-19 patients.
Okay, clear. Thanks.
One last question from the participants, before we close. All right, I believe that's the end of the Q&A session. I'd like to thank everyone for joining us today. We appreciate that you took the time to be with us. I'll just check with Francisca if there are any announcements before we sign off. Professor?
Yes, please. Thank you, Charles. I would just like to thank everyone, especially Professor Mariam from Tunisia and Morgan, and also to thank Beth and Professor Miriam for being with us today. We have good news from Zimbabwe as well, because now it seems we're completing all the countries. We have good news from Zimbabwe as they have successfully installed the FDP locally, and I'm working with CUDA to ensure that we have the VODAN in a box deployed in that country very shortly. So it's really great news for us. I would like to thank everyone for their patience and participation. And of course, Kenya, we're coming up. We are actually ready. We're ready, actually. It's just some few political decisions that we need to take, but everything is also ready for Kenya. So I would like to thank everyone for the efforts, for the patience and participation, for everything. And we look forward to seeing again next week.
Oh, and
right.
Charles, if I may add something.
Very much.
Charles?
Yeah, go ahead, Professor.
Yes, I wanted to also congratulate Professor Francesca, because the KIU graduation of Saturday was a digital international affair. It was very large, and not only was Professor Francesca in charge, but more importantly also was that VODAN was really mentioned there many times by all of the high-level participants, with reference to all the work done in all of our countries, Nigeria, Tunisia, Uganda, Kenya, Ethiopia, and Zimbabwe. So we should all just really be proud and just to acknowledge that it was very much appreciated what has been achieved.
Thank you, Professor Miriam. Thank you so much.
Thanks to you.
So many of our colleagues, so many of our members of VODAN Africa team were actually in attendance, and I would like to thank everyone across the countries from Nigeria, Kenya, Ethiopia, and everyone else who was there. I guess we're going to be posting Professor Miriam's commencement speech on the VODAN Africa website. It's going to be one of the most inspiring things you have ever heard. At least that's what it was for me, and everybody, they were all so excited and appreciative to her and to VODAN Africa for all the work that has been done in the different countries. So thank you all.
Thank you, Francesca.
Great, we'll be looking forward to seeing that speech. A big thank you as well to the Tunisia team for doing this for us today. As always, a recorded version of this webinar will be available on the VODAN Africa website over the week, as well as the YouTube channel. So in case you missed part of it or you'd like to review the topic again to see the Tunisian experience, be sure to check it out. Next week, we will have our 19th installment of the Metadata for Machines workshop on Tuesday. So details on the timings will be shared on the various communication channels, whether it's Slack or the WhatsApp groups. I'd like to thank you all again for joining us, and we will see you next time.
Thank you.
Thank you. Bye-bye. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Bye.
Thank you. Bye.